Good afternoon, all of you. Welcome to the seventh webinar under Healthcare Insight series. And we are very enthralled that we are getting such a good response from all of our participants, our stakeholders, and they are joining our webinars on the regular basis and taking the benefit out of the great topics, the insights given by our experts. Thank you so much for being the patient and the regular audience with the Healthcare Sector Skill Council. So today we have again came back with our seventh webinar, which is on the very important topic on the impact of nurses training on patient safety, quality care, and patient satisfaction. So this important webinar would go around and tell us the importance of nurse training and how impactful could be the nurse training and the type of nurse training given to the candidates. To take up this important topic, we have our esteemed speaker, Miss Anja Stodmister. She is Head of Nursing Excellence from Mversity. Mversity is our esteemed partner who is regularly in collaboration with the Healthcare Sector Skill Council. And we are very thankful to Miss Anja to take out time from her busy schedule and provide her experiential insights to the audience regarding this very important topic on impact of nurse training. So welcome you, Miss Anja.
Thank you very much. I'm very excited to be here today and to share my passion with you guys all.
Thank you so much. And I'm very sure that with your insights and experiences, our audience, our stakeholders, the nurses present here would really get motivated towards the impactful nurse training and would take that themselves on and also provide that kind of training so that it could improve the overall healthcare delivery system. So now from HSSC, it's over to Ms. Anja to take up with this important webinar and this topic. But just before that, a clear question remark to all the audience. For the clear hearing, please keep your mics and your video switched off so that the speaker is clearly visible and you can hear whatever she is giving in her insights very carefully and clearly. Thank you.
Thank you. Can I just make sure everybody can hear me clearly? Is the volume clear? Or do I... Wonderful. Thank you very much. All right. Let me just share my screen with you guys quickly. Oh, goodness gracious me, sorry. Let me just get this out the way. Right, so today's topic lies at the very core of healthcare. As I said, this is something that I'm extremely passionate about because training, patient safety, quality of care is not just a theoretical subject. It's a practical, urgent, and deeply human issue. This is something that affects us all. I'm talking about myself, I'm talking about you, I'm talking about your family members. So no matter who you are or what you do, at some other stage, you will require some sort of healthcare. So our learning objectives today, we will examine the challenges that face nurse training today. This includes anything from limited resources in developing countries to the ever-evolving nature of healthcare itself. So looking back over the last 20, 30 years, there has been an incredible evolvement in the healthcare sector, and it will continue to do so. We will also discuss actionable solutions to address the challenges that nurse training faces, and we will explore some exciting innovations that are shaping the future of the nurse training industry. So by the end of this session, I hope you'll leave with a deeper appreciation for the critical role that training plays in healthcare and a renewed commitment to supporting the education and growth of our nurses. We must remember when we invest in our nurses, we're investing in the health and safety of our whole entire community, we are actually investing in the future, our own futures. Okay, let's start with a personal experience. I would like you all to think about the last time you interacted with someone in the healthcare sector. Sorry? Okay, that was obviously an accident. The last time you were in a hospital setting, whether it was yourself or a family member, you went to the emergency room or you were an inpatient, I want you to think of the impact that you had that was left with you and your family. Was there a nurse that treated you in a way that reassured you before a procedure? Was it their skill in managing your pain or the procedure they were doing that impressed you? Was it their ability to explain the treatment to you? So many times we forget to tell the patient what we are actually doing. Or was this a nurse who was able to calm your fears and your anxiety? The points that I explained above, these are the hallmarks of a well-trained nurse. And hopefully this will leave the lasting impression with you going forward. Now, I want to take the same scenario. I want you to put yourself into the same situation and think of you facing a nurse who is hesitant about the procedure she needs to perform at a very critical moment. Does she come across as being unsure of what she has to do, or who fails in a life-threatening situation when the patient's condition changes? Now, these are very serious and potentially devastating situations, but in many cases, and I want to underline this, these cases are preventable. But I want to know, in this negative experience, what are the emotions that you experienced? Is it anything close to this? Does it make you want to run away? So to get down to the serious part of nurse training, and I want you continuously throughout the discussion, I want you to put yourselves again into the patient's position and think, how would this make me feel? Okay, so I've divided the lecture into
Sanja, I'm
three
sorry, your
parts.
voice has gone. I'm very sorry.
My voice has gone away. Can you hear me now? I'm actually on
Yes, yes,
full
yes.
audio.
Now it's clear.
Oh, okay, sorry.
Not clearly audible. Clearly audible.
Sorry? Can I continue?
Yes, you can continue, ma'am.
Okay, great. So the intense emotions that we got with the last two scenarios, they highlight the importance of nurse training, because nobody wants to face a nurse who doesn't know what she's doing. Okay, so training is not just a pathway to professional competence, it is a matter of life and death, and it's about making your patient feel safe. Okay, so we all know nursing is not an easy job. We work incredibly long hours. We have difficult situations to deal with. So it requires a blend of multiple skills. We need scientific knowledge. We need practical skills. We need emotional intelligence. We will talk more about this, and the ability to make quick and high-stake, life-changing decisions. Okay, so nurses are healthcare providers who spend the most time with their patients. The allied health, the pharmacists, the doctors, they come and go, but the nurses spend the most time at the bedside, which means they are actually the first line of defense. Number one is preventing errors. Number two, detecting complications in the patients. And number three, providing emotional support. Okay, in this role, their training becomes their greatest asset, and we will keep exploring this throughout the lecture. So in the modern healthcare system, nursing training is more essential now than ever. Why do I say this? Because patients are living longer. They're living longer because of better care, because of better nutrition, but they are living with multiple chronic conditions that require complex care. Think of all the new medications that have come out, all the assessment techniques, and all the support. So even though we have great involvement in medical technology, and we're able to assist the patients, advanced treatment often reshapes of how the care is delivered. So if we take everything and put it together, what do we expect for the patient and what does the patient expect from us? Okay, so I can tell you for sure that as our patients become more educated, they start expecting more from their healthcare workers. This is not just the treatment, but also the care that includes the compassion, the human side, and the support that we bring. They expect personalized care. My needs and my expectations are not the same as yours or the person next to you. Okay, we all have specified needs, and we expect these needs to be fulfilled, high quality care to be given. There's no compromise. Okay, so these changes have definitely placed unprecedented demands on the nursing fraternity, making comprehensive and ongoing training an absolute necessity. Now you will see a repetitive thread running throughout the lecture, and this is it. Okay, so how the nurse training directly impacts us and the patients are in 3 key areas. Okay, number 1, patient care and patient safety, quality of that care we deliver, and also the patient side, their satisfaction and met expectations. We will discuss these 3 factors individually and at length. Okay. Sorry? Okay, so each of these areas I mentioned are deeply intertwined. Okay, and we cannot separate them. So it's the clinical part, it's the patient experience part, and it's the quality and safety factor. So when nurses are well trained, they are better equipped, as we said, to prevent the errors. And this must be our number 1 priority, is first, do no harm. Okay, it allows us to deliver effective and evidence-based care, which is extremely important to make sure that we are delivering the correct care, the best care. And we also want to deliver a positive experience for our patients. We want them to walk away thinking they were respected, they were heard, they were cared for. And we want them to go out and tell their family and friends, these healthcare providers are fabulous. They are safe practitioners. You can trust them. Okay, so when nurses are well trained, they're better equipped to prevent errors, as we say, deliver that effective and evidence-based care, and create positive experience for the patients. But when the training is inadequate, obviously our safety risks increase. The quality of your care is going to suffer, and your patient satisfaction is going to increase. So you will see these 3 are very much entwined. Okay, and this is not what we want for our patients. Okay, so let's begin our journey by taking a step back to understand the foundations of nursing care. What does it mean to train a nurse? So it's no longer just about teaching nurses how to administer administrations, take blood pressure, perform CPR. It is so much more complex. It is actually transformative. So let's take a scenario for a moment. I would like you all to think and reflect on a patient who is in the emergency room. The patient arrives with chest pain. Okay. Now you are there as the visitor with your mother, father, brother, sister, whatever. What are your expectations? If you have a well-trained nurse that responds to the situation, she assesses the vital signs. She doesn't wait for the doctor. At the same time, she administers the oxygen when it's necessary. She recognizes the potential side effects of medication administered. She will administer oxygen if needed. She will ensure that by the time the medical team arrives, they have all the information to make informed decisions. Okay. So being at the nurse's bedside, the nurse being at the patient's bedside, if they see a nurse who knows what they're doing, who appears competent, she establishes trust with the patient and the family. Right? So she walks in, she quickly assesses the situation, and she has to decide on the best course of action. Okay. Now, this interaction might seem routine if you're working in a hospital or you come to visit and everything is working perfectly, but it is not routine. Okay. So behind the calm demeanor of that nurse is years and years of preparations. We're talking education, we're talking practice, and we're talking the ability to combine that knowledge with empathy. And this is the very essence of nursing. Okay. So as I said, it's not just about acquiring your technical skills. It's about preparing someone to step into the role where lives are literally at stake. Okay. Please let that sink in. This preparation definitely doesn't happen overnight. Okay. The basic nursing courses are 2 years, 3 years, and the more advanced are 4 years. But it begins in the classroom, it continues in the clinical setting, and it evolves throughout the nurse's career. Okay, so the longer they are actually practicing, the more confident they become, the more clinically skilled they become. Okay, so when we're talking about the training process, there are 3 interconnected elements. Firstly, we have the theoretical foundations. Then we have the clinical aspect and the professional development. Okay, so if we talk about theoretics first, the nurse spends countless hours. We study anatomy, physiology, pharmacology, microbiology, etc., etc. So we have to know how the human body works and what happens when things go wrong. Because if we don't understand the normal, we cannot identify the abnormal. Okay, we need to understand how various treatments can actually address the problems. We need to understand the why and the what for. Okay, so this isn't just about memorizing facts. This is about understanding the process, the journey. Okay, so building a deep understanding of science of care. So if we talk about the clinical aspect, this is where theory meets practice. In the hospitals, in the simulation labs, the nurses learn to apply what they've studied. Okay, so we can take all that theory, we can put it together, we can now practice our clinical skills, we can put up intravenous infusions, we can administer medications, learn to monitor vital signs, and operate all those various medical equipments. Now, this is a lot of practice that needs to put in place, and these skills are then honed under the supervision of experienced mentors and guided through the complexities in the real world situation. So we can teach nurses the practical skills, allowing them to be competent and feel confident before they go to the patient bedside. Okay, and then obviously the third aspect is professional development. So in the world of healthcare, nothing stands still. New diseases emerge every day. I mean, we had COVID quite recently that stopped the world totally. We've got constant technological advances, and these are very exciting. And our best practices evolve and change for the better. Now, in order for nurses to keep pace with all these changes, we need to go through continuous education. We need to do various certificates and specialized training. Okay, this can at times feel very, very overwhelming. Okay, and it is actually a lifelong commitment to learning, which ensures that we remain equipped to provide the best care. Hello? Is there a problem?
You carry on, Ms. Anjal.
Okay, so let's take another moment to reflect on why nurse training is so essential. If we go back to the scenario in the emergency room, when the patient arrives with a chest pain, okay, so our very well-trained nurse is not going to hesitate. She's not going to wait for directions because every second counts, okay? Her training, her interpretation means the difference between life and death, okay? Now, healthcare, as we said, is very complex, and mistakes can happen with serious consequences. Okay. If we take, for example, in pharmacology, everybody knows there's the different rights of administering medications. We have to learn about the interactions, the side effects, the relief that certain drugs bring. This is for the very reason because we are protecting our patients from error. Imagine being looked after by a nurse who does not understand the difference between two medications. They sound similar, but they've got very different actions. Now you are depending on her training, her experience, her interpretation to make sure that you are receiving the correct medication and not have a medication error. Then we have a second example of a nurse who's trained in infection control. Okay. So infection control is all about preventing the spread of infection. Now, these are basic principles that you will learn along the way, like hand washing, which is your very number one barrier against infection. There's hospital-acquired infections that are spreading fast and furiously. You've got your superbugs. So if your nurse does not have an insight into the process of infection control or the transmission of an infection, she will not be able to protect herself, her patient, or the other staff. Okay, so let's think about that for a moment. Imagine working with people who are actually not trained or equipped to provide the care. Will this actually include or increase the burden on your and your patients? Okay, so as I said, it's not just about technical competence. Nurse training also emphasizes the human side of care. Okay, so if you think back to a very memorable and good experience that you had in the healthcare sector, was it a hospital, a clinic, wherever? Okay, was there a nurse that took the time to talk to you, to listen to you, to make you feel heard and cared for? Okay, that is the human aspect. Because we get so busy with everyday life, we've got lots of patients on the list, all these procedures we need to do, we forget about the human side. Okay, so to really understand nurse training, it helps for us to look back how it evolved over time. So in the early days, there was really no structure. It was not a formal profession. Training was informal, inconsistent. If we think about the early First World War, people actually learned by observing others through trial and error. Now, these are scary circumstances, okay? Then we had a dramatic change in the 19th century, luckily, when Florence Nightingale came along and she emphasized the importance of education, scientific knowledge, and also hygiene. She started the whole ball rolling. Okay, so luckily Florence established the first nursing school, and this set the stage for the modern structured programs. Okay, lovely. So over the decades, nurse training has continued to evolve, thank goodness, and it's incorporating advances in medicine and education. And in the mid-century, focus shifted totally. This is towards establishing the criteria and curriculums we have nowadays, and also establishing licensing requirements. Which brings us to today's nursing training, which is a rigorous process. As I said, it's not easy, but it prepares us to meet the ever-growing demands of healthcare. Okay. Modern training programs are designed to address the complexities of today's healthcare landscape. As I said, it's forever changing. But nurses are no longer just nurses and caregivers. They also have to be educators. They have to be patient advocates. They actually have to be leaders for themselves and for their patients and their colleagues. Okay. So nurses, as we are, we adapt by using advanced technologies. We collaborate with interdisciplinary teams. You've got your allied health workers, you've got your doctors, you've got your other assistant services. And unfortunately, sometimes we have to work in resource-strapped environments, which makes things more difficult, but there's always a way to do things, and we will explore that further. And we also have to navigate the challenges of providing care in a very diverse culture. If you just think of India, your various religions, your cultural differences, your different foods, it makes it very, very diverse. But first, let's talk about technology nursing, and this is one of the very exciting parts. As we discussed, training plays a really critical role in preventing errors. But nowadays, we've got very state-of-the-art simulation labs, okay? And they have revolutionized how we as nurses learn. What we are able to do now is replicate real-world scenarios. So whether you're in the simulation lab or whether you're in your virtual reality screens, we can actually make sure that you feel immersed in a real world scenario. It feels like you're at your patient's bedside, but the procedures are being performed in a safe and controlled environment. And this is very important. It gives you confidence and makes you feel safe as a nurse so that you can practice and make sure that you're competent, okay, in these nursing procedures. And the other wonderful thing is we are able to provide immediate feedback, okay? For example, if we do CPR, we can tell you you're not pressing hard enough, you're not pressing deep enough, your rhythm is not fast enough, okay? So we immerse people in training to build their confidence and competence. And I re-emphasize without any risk to the patients, and this is the great part. Okay, we just briefly spoke about virtual reality. In our labs, we have got virtual reality opportunities, and it feels like you actually step into a virtual hospital, and it allows you to make certain decisions, and based on those decisions that you make, you will have different outcomes. And this will allow you to practice the management of different scenarios. So if you make the wrong decisions, your patients will deteriorate, or it'll take you to a different scenario. Okay, so it is quite incredible, the realism that you do get, and you actually feel that you're actually there at the bedside. And this is one way to prepare everybody for the work environment. So I'm very excited for everybody to experience this. Okay, so despite all the advances in nurse training, there are also challenges that we face. Like I said, in many parts of the world, there are resources. If we go into the more rural places, they don't have the same setup, they don't have the same equipment that we have in the cities. And the other problem is that nursing schools don't all have the same up-to-date textbooks. They don't have the same supplies that we have. So maybe they are not able to practice the intravenous infusion, your IV insertion, not able to practice the phlebotomy. Okay, this unfortunately creates a disparity in the quality of training that can be delivered. Okay, and also, once again, the potential serious implications if you go to a patient and you've not had a chance to practice. To me, that's a very scary concept. The other problem that nurses face are extremely long working hours. sometimes doing double shifts, working with incredibly high workloads. So there is very little time we can put aside for personal and professional development. Okay? So unless we are dedicated and we make the time, we unfortunately get left behind. Then we also have the human element. And let's be realistic, we are all resistant to change, to adopting new technologies or method, because this is the way we used to. This is the way we've always done it. But it does not mean it's the right way. So how can we address these challenges? The first is to invest in training infrastructure. I realize this is not always possible in some areas, but we can make sure that people have access and have opportunities, whether it's to build simulation labs and updating our curricula, or providing access to online learning platforms. Now, online learning has become a lot more popular. It's become a lot more accessible. And fortunately, it gives everybody an equal opportunity to learn at least the theory part. Okay. So secondly, we can, in our training centers, within our hospitals, we can create a culture that values lifetime learning. We can create mentorship programs, and we can actually provide flexibility in the schedules. The big thing is to allow time for training. There's nothing worse to be rushed through an 8-hour or 12-hour shift. You're overwhelmed, you're exhausted, and now you have to go and do training. This is reality. Okay. The other thing is to recognize the nurses that do take the time, who make the effort, and who pursue the professional development. Thumbs up for you. The third way we can address these challenges is to focus on equality. Is everybody getting the same access, the same chances, the same high quality training? Now, this cannot be addressed at the nursing level, but at the hospital and the training center levels, at government centers, definitely. Okay. So just to summarize, nurse training, which are the very foundations of effective healthcare. It equips the nurses with skills to navigate the complexities of modern medicine. And also important, the foundation is to maintain the human touch. And we, as overwhelmed nurses, sometimes forget that part. Okay, so building knowledge, building confidence, building compassion, and to make the ability to make a difference in people's lives. Someone's microphone is on.
Of a modern medical.
Please check your mic.
Many investing in a nurse training, not just
Ashish Kumar. Mr. Ashish Kumar, can you please turn off your mic? Thank you. So as we move forward, everybody, let's remember, investing in nursing training, it's not just investment in the healthcare workforce. It's an investment in the health and well-being of ourselves and our communities, our families, everybody around us. This means that every nurse that is trained takes us one step closer to a world where every patient receives the care they deserve. Isn't that a wonderful thought? Okay, so if we come to section number 2, which is patient safety, this is something that I'm extremely passionate about, because everything we do comes down to the safety of our patients. Okay, so nurse training and the understanding is the focus point, the critical areas to patient safety. Patient safety protocols, procedures, that prevent harm from patients in delivering their care. As I said, our first priority should always be first, do no harm. Now, this can be anything from correct medication administration, preventing those infections from spreading like wildfires through a hospital, and recognizing those early warning signs of complications of your patient deteriorating. These are all skills that can be learned, that can be honed by all of us. Okay, because as nurses, please remember, you are at the very heart of this effort. You are the cornerstones. Now, to understand how nurse training affects patient safety and patient outcomes, I've got two scenarios. If you think about a patient who is admitted for a routine procedure, such as appendectomy. Now, you walk into the room, your patient is anxious, she's crying. She says to you, I don't know what's happening. I don't know what they're doing. Okay. So what will you do? Will you comfort your patient? Will you reassure your patient? Will you give them the education they need to be able to understand? Okay. Or will you be the nurse who's in a hurry, who brushes off the patient's concerns and you say, don't worry, everything's going to be okay, and you rush off to your next patient? So how do you think either patient feels? How do you want to feel in that situation? Okay, so I hope you're all leaning towards the patient that is compassionate, who takes that extra minute and reaches out to the patient and educates. Okay, so training equips everybody with the knowledge and skills. Number one, prevention of errors. Now, medication is a wonderful thing. It's got multiple uses, but it's also our number one cause of medical errors. Think about that. This is why pharmacology training and knowledge and upskilling is so important. Okay. It's the knowledge to intervene correctly when things go wrong. Think of your nurse on TV in the emergency room who goes under pressure, she does the right things. It looks like she's doing multiple things at once because she knows what she's doing. She's been trained. She's confident. She's working as part of the team. Or think of the nurse who's standing in the corner looking around anxiously, not knowing what to do. Okay, we want that confident nurse to look after us, the one to make those critical decisions, especially when under pressure. So I must say again here, without the proper training, even a nurse with the best intentions can overlook critical and crucial details or hesitate when it is most important. This is why patient safety must start with education. Okay, so I skipped the gun here. Medication administration is one of the fundamental aspects. So the good news here with medication is most of these incidents and events that happen are preventable. Okay, so there's still time to turn things around and ensure patient safety. Then again, another critical aspect of patient safety is infection prevention. Now, the hospital-acquired infections, as we said, is a significant concern, and this is worldwide. I mean, there's superbugs coming out of every country these days, which is making healthcare more complex, which is extending your patient days, which is requiring more antibiotics. More antibiotics use actually causes more resistance. Now, the good news here is that the health-acquired infections are often preventable. Can I put an exclamation mark here? The nurses as the frontline defenders against health-acquired infections. And it starts with training, the basics in hygiene, sterilization techniques, hand washing between patients, after patient care, can dramatically reduce these incidences. You have the power to change things. So just quickly touching on critical thinking and situational awareness. This is another one of my passions, is to teach critical thinking. Right, the nurses at the bedside, as we said, spends the most time with a patient. She or he, will be the very first to notice that there's a change in your patient's condition before deterioration actually takes place. Why do I say that? Because she's monitoring vital signs. She's watching the patient's symptoms. She's talking to the patients. They are telling her little signs and signals that things perhaps are going quite as planned. So those subtle changes, which are often overseen, that might indicate trouble. If you've got critical thinking skills, if you are showing awareness of that situation, you are able to recognize, you are able to manage, and you're able to escalate correctly. Okay, so we want to do this quickly and we want to do this appropriately. So one way that we actually do critical thinking training, and it's actually very fun and very interactive, is number one, simulation training. We do role plays, we do mock scenarios, and we practice responding to various emergency situations. Now, this could be anything from your patient collapsing next to the bed. This can be your patient falling out of bed. You as a critical thinker, how can you control the environment that your patient is in? Okay. Now, with a lab skill or with VR training, our nurses are allowed to make mistakes because this is how they learn. There is no real patient involved, so there's no danger. Okay. So this is the perfect way to learn and to hone those critical thinking skills. So the results, this is what we all want, are nurses that are better prepared to handle those real life emergencies. I definitely want a nurse looking after me who knows how to identify that I'm having a heart attack and take the corrective action. I want that nurse who is confident, who knows precisely what to do. And I hope you all feel the same way. Right, so the other thing you will hear mentioned often during your training, during your working hours, is teamwork and communication. Now, I cannot stress enough the importance of teamwork and communication. Okay, patient safety is not one person's responsibility. We have to collaborate with everybody else on our team. We need to learn to effectively communicate. Okay. If I do a handover at shift change and I don't tell the next team coming on about my concerns for the patient, okay, this is a huge gap in communication, which leads to errors and missed care. So just think about it next time when you are communicating with your fellow team members. Are you giving 100% teamwork? And are you actually partaking in the best communication? Now, we provide training programs that emphasize teamwork and communications, and these are also a lot of fun because they are very interactive. They put you in scenarios with the patients. They put you in scenarios where you are a family member and you learn to work through these different situations and you learn the different skills to handle the situations effectively. So role play to a lot of people is very scary, but it can also be a very good training tool and it can be a lot of fun because you get that instant feedback. Okay, so the power of training, we've got multiple scenarios. If there's one hospital that I read about in the USA who had an extremely high rate of patient falls. Now, this is one of my horrors, is there should be no patients falling. But unfortunately, especially the elderly patients, they get confused. We forget to put the cot sides up. So by actually assessing your patient's risk of falls, the program that we implement, number one, identifies your patient at high risk of falling. Okay, and then we teach you the control measures to put in place to make sure falls don't happen. There's nothing worse than having a patient who is almost on the way home to being discharged, and the next minute they fall out of bed and they break their femur. So your patient is now in pain, they have to stay in hospital longer, they are taking away from another patient the opportunity for beds. So we can take proactive measures. Please remember this, everybody can take proactive measures to prevent this happening. Okay, and then the second scenario, if we talk about early detection of sepsis, there was a very interesting case in one of the Uganda hospitals that got written up that obviously had no resources. So the hospital introduced a nurse training program of how to use the simplified early warning system. Now, we use this very effectively also in the ICUs to identify deteriorations in your patient. But in the scores that they actually developed, they could identify your patient's risk. And with the tracking those changes in vital signs, basic heart rate, respiration, blood pressure, they were able to identify the patients that were at risk for having infections. Okay, so despite all these resource constraints, these programs were still very, very effective, and they actually, someone's writing me notes. Okay, so even though we give the best training in the world, even though we go to all this improvement training, we will always face challenges. Now, to overcome some of these barriers, there's been multiple write-ups of recent about a collective and collaborative effort. It's going to take hospitals, it's going to take the government, it's going to take various educational institutions to work together. We need to come together and support everybody and each other. We need to invest in training infrastructure, and we need to provide access to the learners. Okay. Looking ahead, the future, especially with the technologies that are coming on board now, are extremely exciting, and I hope you're all going to be part of that. Okay, so that's the end of patient safety. And I hope everybody can take something home from the past slides before we move on to quality care. Now, you cannot talk about patient safety without quality care. And this, once again, how training directly impacts the quality of delivery and patient care. Okay. So we're not just talking about clinical outcomes. We're not just talking about the effectiveness of treatment. We're talking about how quality care is delivered. Okay. Can I say that again? How quality care is delivered. Right, so we need to ensure that the care that is delivered to the patient is safe, that it's efficient, that it's patient-centered, it's delivered with respect, compassion, and dignity. This is like a wish list, okay? And our ability to connect with patients on the human level. Now, if we talk about the different critical elements of modern nursing that affect quality care, the first one is evidence-based practice. Now, nurses who have got evidence-based practice are taught to rely on the latest research and data to guide decision-making, to make sure we're using the best treatments, the best medications, the best processes. We want to make sure that it's effective and also cost-effective treatment. If we use evidence-based practice, it doesn't help you spend thousands or millions on a treatment that's not proven when something much more basic, more cost-effective can actually do the job. Because remember, it's about the patient and what's best for them. So we want to make sure that our practice are in line with the current standards in healthcare, because we want to contribute towards better outcomes for the patient. And someone's drawing me more wriggles here. Thank you. Now, our second critical element is communication once again. It doesn't help to have all these beautiful technical skills that you've got, but your interaction with your patient and your colleagues is not effective. So once again, skills and communication go hand in hand. So as we said earlier, if your patient feels that they are heard and understood, they are much more likely to take care and participate in the actually healthcare plan, to follow the treatment plans. If you think of a patient with diabetes, if they do not understand their condition and how nutrition, exercise, all those factors, let alone medications, affects their care, if they don't have that insight, you cannot expect them to actually sign on board and actually partake effectively in their treatment. And this is what we want. But we can only do this, achieve this through effective communication. Again, once again, we spoke about this earlier, the coordination, because nurses are the bridge between your patient and all the other healthcare professionals, and at times also family members. Okay. So then number 4, we've already spoken about the use of technology. We spoke about the advances in all the tools, all the different systems. They improve our efficiency nowadays. They improve our accuracy. We've got all these beautiful metrics. We've got wonderfully designed health record systems. They improve the patient's quality of life in one way, but they also make the nurse's life, professional deliverance, much easier. And hopefully it will also reduce the length of stay and readmissions. So nurse training programs focused on the prevention of infection. We've spoken about this, the comprehensive infection prevention training programs. And as I said, we combine workshops, simulations, role play. But what I want to mention again here, please, is the hand washing, the 101 of infection control. And then also we've got patient-centric care. What this means is, as we said earlier, each one of us has got very unique needs. We've got different expectations. So if a nurse is trained in cultural competency to recognize, to respect and address our different backgrounds, our beliefs, our preferences, whether they're religious, whether they're cultural, that will get a buy-in from the patient, that they trust us and that we are taking the best care of them because we're looking at them as individuals. So quality care, yes, can be helped through training. It can be improved through training, but we still have challenges. As we said, nurses will always continue with high workloads, high pressure environments, tight schedules, and also the rapid pace of technology, the continuous updating. Okay, so how do we as leaders help the nurses address these challenges? We are able to create a supportive learning environment. Now, I cannot emphasize enough how important this is from the learner's perspective. If you are being told you work from a hospital chain that supports learning environment, but they don't actually prioritize timing, they don't actually allow you to go and do the training, if they do not provide the training, this does not show a supportive learning environment. Okay. The scheduling of protective times to attend. Investing in online learning platforms, I realize this is not in everybody's ability financially, but there is more flexible access these days. And also the providing of mentorship programs that provides guidance from the very experienced nurses to the junior ones. It's basically buddy system and helping them along step by step. Okay, so we've spoken about virtual reality quite a bit, the augmented reality. This is the ability to practice very complex procedures, immersive ways. It uses artificial intelligence. These programs are quite amazing to work with. Not only do they give a personalized learning experience, but they also adapt to your nurse's strengths and to the environment and the choices that are made. I hope you all get a chance to actually experience this. So if we summarize quality care, nurse training is the backbone of quality care. It equips us as nurses with the knowledge, skills, and empathy we need to reach out to our patients and to also navigate the complexity of modern healthcare. So anyone who's been in nursing for more than 10 years will know how quickly things change. And we also ensure that patients receive the highest standard of care. Okay, and we've already mentioned all these parts before. And my big drive is to empower nurses. Now, empowering nurses are not just words. We want to make a real difference in our patients' lives. So as we continue to advance in medicine, in technology, the role of training is just so much more critical. Okay, so we invest in nurse training, okay, but also the health and welfare of our communities. So to empower your nurses, we need to give them the training. We need to make sure that they are critical thinkers, that they are confident, that they're able to communicate and advocate for the patients. Right, so last section, patient satisfaction. Now, as we know, patient satisfaction means very different things to different people. So what I might value very highly might not actually rate very highly for the next person. Okay, so it depends on our upbringing, it depends on our background, it depends on our past experiencing, but everyone actually bases their measures on different things. So when a patient walks into the healthcare facility, they nowadays are not just looking for treatment. They're looking for specialized care. They want to feel safe, understood. They want to be respected. Pardon me. So while patient satisfaction is influenced by a lot of factors, and I mean, you can all imagine, you can think of different scenarios. It can be anything that happens within the hospital or the healthcare setting, but nurses are often the ones who leave the lasting impression. Okay, this can be their words, their attitude, their actions. Is it a nurse that actually took the time to smile? Did she hold your hand while you were scared and anxious? Her demeanor, or was she just cool and not interested? Was she too busy with her other patients? It comes down to behavior and actions. Okay, so you don't need great skills, you don't need great equipment to make the difference, but you can take that extra time and attention with your patients. Okay, so if we take a scenario out of real life, your patient comes in, they are very anxious. It might be an elderly, confused patient in a very busy ER situation. Now, a patient that has got dementia who's already confused will not be able to cope with the situation. So just imagine a nurse coming along who's not interested in assisting versus the one who will take her hand and try and reassure her, make sure she's got the support she needs. Now, why do I say soft skills? Soft skills is anything from communication. It's understanding. It's the way we talk to our patients, the way we respond. And the good news is soft skills can be taught and we can all teach them. We can all learn them. Okay? We can actually carry across this ability to other people. Okay? Now, the moments don't come by chance. Okay? The nurse that stopped, took your hand, who reassured you, who explained things, and actually made sure to bring up a family member or someone to support you in an unfamiliar environment. Okay, this did not happen by chance. This nurse was trained in interpersonal skills. She showed emotional intelligence, okay, and she understood the requirements, what it means to deliver exceptional care. So at the heart of it all, what does it mean to connect with your patients? What does it mean to satisfy your patients? Okay, this is to do with expectations, it's to do with training, but mostly it's about practice. And very much it relies on supervised, on-the-job experience. Okay. So we do fabulous audits. We try and measure patient satisfaction. People come around with clipboards or with tablets, and they ask you, how did you find our service? So anyone who does audits or who works with patient satisfaction knows there are multiple influences. Okay. But the main ones that I want to point out to the nurses, it's when your patients feels heard, respected, and cared for. And this does not take a lot of time or effort. It just takes that ability and that willingness to reach out, to make a difference. Okay. We all have those days where we feel incredibly rushed, we feel overwhelmed, and we're inclined to go for the impersonal route. But this is where patient dissatisfaction actually comes in very, very quickly. Okay, so I've just put a quick slide here. There are so many aspects to the patient experience, but the nurse is at the very heart. And yeah, the fabulous news is we can make a difference. So if we talk about different elements of patient satisfaction, sometimes the complaint comes in, we have just not had the response that we expect. You've been too slow. I've waited for my pain meds. My food has gotten cold. So we teach time management and prioritization. Sorry? Okay, it's the ability to personalize care. We've spoken about this. It's patient education. It's very important. Clear use of language and visual aids to guide your patients. So listen carefully, be responsive, understand the needs and expectations, encourage feedback, and measure what you're doing and improve. Okay, I think we've actually run out of time. So just basically, quickly, nurse burnout is a very, very serious issue. This happens in high stress environments, heavy workloads, and the demand. Okay? But we can make a difference as healthcare management to actually support the nurse, include strategies like stress management, emotional resilience, and create that environment that prioritizes nurse well-being. Okay. I'm going a bit quicker now because unfortunately we've run out of time. There's the resistance to change we mentioned with all the different technologies, changes in protocols. They become overwhelming. And yes, we do realize that. The cultural and language barriers we've spoken about, the emotional demands we just keep on with nursing. And then in conclusion, the challenges are significant. Yes, everybody acknowledges it, but there is opportunity for change and there is opportunity for mitigation. But we need to invest in creative solutions, collective commitment to supporting our nurses, and we can overcome these barriers to not overpower our nurses, sorry, but to empower them so they can grow and succeed. Okay. So as we approach now the end of the lecture, it's time for all of us to look forward. And the questions we must answer together is how can we enhance nurse training to meet the evolving needs of healthcare? And what steps should we take today to prepare nurses for the challenges of tomorrow? So all I want to end with is let's make a difference together. We can address all these scenarios, all these challenges. We can make a difference. Okay, just a quick picture of patient satisfaction. Thank you very much. I don't know if there's time for any questions.
Thank you, Ms. Anja, for this such an insightful session. Audience, from you, if you have any questions, please post your questions on the chat box so that we could take it one by one. Meanwhile, we are having a quick poll for the audience to see that how much they were able to register what Ms. Anja has just talked about. So I'm just starting that poll for the audience to give your responses on what you have learned today. Can we have the poll, please? So the poll has started, and we have 4 questions, and we have around 2 minutes when the poll would remain here. Audience, please take up their questions and give your valuable answers. These are multiple choice questions. I think so. Okay, so we have started with the first one. Okay, good. Last 10 seconds for the poll. So are we still doing, or shall we end the poll?
5 minutes. At the rate 5 minutes.
Okay, so we are going to end the poll. and we have got the results. So we have the questions like what aspects of the training were particularly valuable or engaging? And there were three options: patient safety, quality of care, and patient satisfaction. And maximum, so there is a tough fight between patient safety and quality of care. So Miss Anja, what is the right answer? Or all the answers are right?
They're all right because they're all interconnected. It's just I ran out of time and I actually skipped over a lot of the patient satisfaction factors. But you actually cannot separate the three. They work hand in hand.
Right. So all three are very important. So all who have answered whatever, so they have answered correctly. Second question was, were there any topics or areas that you felt needed more coverage or depth? In today's session, if you have seen, what type of patient safety, quality of care, or patient satisfaction, in which area you felt needed more coverage? So we got like the patient satisfaction as the major poll answer.
It looks like we need to separate the three.
Okay, so the next is, did the overall training environment help enhance your learning experience positively? So lecture contained too much information. Yeah, additional information would be helpful. A synopsis of current views could be expanded. So the lecture was quite comprehensive. All the people feel like that. So kudos to you, ma'am. So you have well covered all the topics. Would you like to receive more information on these courses? Maximum of the people wants the same. So thank you so much.
Yes.
If we have any questions in the chat.
Madam,
Hello?
I have a question.
Yes.
Can we get any certificate
Certificate for what?
for this course?
This was just a lecture. It's not a course. We've got separate courses that we cover. I don't know, Dr. Mega, if you guys do attendance certificates.
If we got if we get the participation certificate, will be better for us and inspire also us.
So, Mr. Sushil, you will get your own type of reward, but not the certificate. So this is just a webinar for the orientation sessions. Okay, so the next question, what we have from the chat, ma'am, please explain opportunities to nurses in US and UK. So what type of opportunities are there for nurses in US and UK? If you can enlighten some bit on that.
Okay, so there's a lot of opportunities. We are actually at the moment working with companies in Japan, in the UK, in Germany, US. There's a lot of opportunities for nurses to actually fill the gap. There are an incredible amount of vacancies available throughout the world. The big thing is you must remember you need an English language proficiency exam that you need to pass. And this is usually your IELTS or your TOEFL, but this can be done online. And you also have to do, especially for America, your practical exam, which is your NCLEX. So this one you can also do online. It takes about 6 or 8 months of hard study and preparation. But it is an online exam. So once you have passed those two, then the next steps to actually moving to a new country become much, much easier.
Thanks, Ms. Anja. So one has asked that how should a patient be handled if he's in a bad mental state?
Okay, so psychiatric patient. Okay, so let's face the situation. being inside a healthcare environment is an abnormal situation. Okay. Everybody is anxious. You don't know what your outcomes are going to be. You see people moving around, no one's talking to you. So from my side, the best thing you can do is to reassure that patient, to make sure they understand what's going on, to understand their treatment options so they can make an informed decision. If it is a mental health case, then obviously the scenario changes and you would have to bring in psychiatric skills and probably psychiatric support. Is that what you're asking?
Hello,
Hello?
hello, madam. First of all,
Hello?
I am Dr. Dhiresh Chaudhary from Kolkata. I am
Hello?
practicing geriatrician.
Yes.
So, first of all, thanks for your lucid presentation and covering all aspects. And I would like to mention some points. That is, another important aspect of the nursing is in the home care.
Yeah, please do.
Whoever is engaged in the home care, because now the majority of the elderly patients, they are so much confined in the home because of their physical constraints and other aspects, social cause. So in that aspect, the home nurses are not so much oriented about how to deal the geriatric patient, and even their behavioral and attitude towards the patients and orientation about how to deal the geriatric patients. So that's why the training is very important. And obviously that 8% of the geriatric people are totally bed confined. And in our Kolkata, I have conducted one study where 35% of the elderly people are bedridden and caregiver dependents, or home nurse dependents. So that's what a very important aspect is the training of the home care nurses. And one another important point, ma'am, the nurses are not at all oriented about the spirituality aspect, religious aspect, because this aspect is also very important, especially whenever they are dealing with the intellectual or spiritual people. Because if they don't know the spirituality aspect or religious aspect, they are food, culture, all depends on that. And another one point they are missing, that is the intellectual component of the patient. They are so much what they are habituated with the gossip like TV serials and that sort of things. But the people who are intellectually high, they are not eager to discuss about this matter. But that creates the one sort of thing, that is the depressive attitude I have seen in many elderly patients. They have isolated just because of they are not eager to discuss about this TV serial and that things. They are so intellectually high. They like to discuss about the intellectual component. Okay, so these are very important aspect even in the training part also. So what would be your suggestion in this regard?
What I suggest is we actually collaborate on this and actually present a presentation together. How do you feel about that? And we address these issues together.
No, presentation is excellent.
No, I'm talking about a presentation which actually addresses specifically home care and the specific requirements.
Yes.
No, we actually are busy with a program for home care, and we're working with some of the companies, and some of these aspects are actually being addressed. But
Okay.
obviously, it's a huge country, and we cannot do everyone together. But we have started taking the steps. But I think, Dr. Mega, I think you might have someone here who can assist with your next lecture. A
So,
totally different concept.
That's a good suggestion, Miss Anja. Next time, we could also see that if we could make a collaboration within the organizations together and have a panel discussions as well, apart from this regular webinars. We could,
There you go. You've got your
could have
first
it.
2 people for your panel.
True. We could
Thank
do.
you, Dr.
We could do
Deris.
that. So I think so we are good enough with all the questions to be covered. And thank you so much from whole healthcare sector skill council team to Miss Anja for taking out your valuable time and providing such an insightful session to the audience. And I hope everybody have got a real insight that how the training of nurses should be taken place so that we can have the better healthcare delivery. Thank you so much.
Thank you very much for the opportunity.
Thank you.
Thank
Thank
you.
you, audience. Thank you
Thank
for
you.
the patient hearing. Thank you.